Welcome to NAWBO Boost. If you have not been on a Boost program, welcome. We developed this program over a year ago to provide insights from NAWBO members to share their area of expertise with other NAWBO members and guests. And we have had the pleasure of having lots of fantastic speakers, variety of topics. It's really is like a bit of a mastermind type setup, so we love it. And super excited for today's presentation with Dr. Melissa McRae. She is a board certified family medical physician and founder of Vitality Natural Wellness. She has way more of a biography than that, and she can chat about it, but I like to keep it short, throw in the intro, and we'll learn more about her during the presentation. So I see my internet is a little unstable, so I am going to go ahead and turn it over to Dr. Melissa. Thank you so much.
Thank you, Molly. Good morning, everybody. No matter what time it is, if it's super early or just regularly early, it's a Friday, so we'll celebrate that a little bit. I'm Dr. Melissa McRae, and I have my practice location is in Mansfield, Ohio. We have a second location in Powell, Ohio, so we're Midwesterners. I absolutely love what I get to do as a functional medicine specialist. So a little bit of my background. I've only ever known wanting to be a doctor. So I remember at the age of 3 wanting to be a doctor. I feel incredibly blessed that as I went through school, that's all I wanted to be. So I didn't have to kind of navigate, oh, what do I want to do with my life? I just always wanted to be a physician. I came out of medical school and had the opportunity to be employed for a while, and I learned what I loved about being employed, and I learned what I didn't like about being employed. After that, I had the opportunity to start my own practice, and I was a traditional setup. So we took, regular insurance and had the normal family practice scene set up. And what I was noticing is I love to spend time with patients. I love to engage with the family and get to know the unit. And that time was getting cut shorter and shorter by what I could do to financially stay viable. You can't spend 45 minutes with patients and then survive in a medical practice as a self-employed physician. So it really became the point of, do I want to join I call it the rat race of medicine and hop on the wheel and see, 6 patients an hour and do the thing and have a great lifestyle? Or do I really want to focus on what I feel is right and what is good medicine and how to take care of people? So I did that. So I closed my traditional practice. I opened up Vitality Natural Wellness. I spend as much time as I want with patients. We typically get patients who are motivated to come in and be well, and we have a focus on returning the body to a state of wellness. It is fabulous. I love it every day. I'm amazed at what the human body can do and how it's made to heal and repair. We tend to see a lot of patients who have gut issues. Hormone issues are such a big thing. As I get older and as my staff as we all continue to age, we've naturally started to land in this space of perimenopause and menopause, and we have a lot of patients come to us with those kind of concerns. It also shows and highlights, as we listen to these women's stories, what a huge issue we have in society and in business with menopause, how it affects our bodies, how we actually function, and how we're perceived in the workplace. And that really led me to what today's presentation is going to be about. It's menopause in the workplace. So my goal for this presentation, I would love interaction. I would love questions. Please feel free to interrupt me, ask about anything. I'm totally fine if we don't cover everything that I had down. I would much prefer that you get what you need from today. So my goal is you're going to be stronger and wiser and less afraid to express your thoughts about menopause after today's conversation in the workplace, that you can just be empowered to be who you're meant to be and have a deeper understanding of what your mind and body are going through. It's an incredible season of your life, perimenopause and menopause, a nice and a profound journey, and one that you can thrive in. And that's our goal, is to thrive in the season of perimenopause and menopause. So menopause affects every single woman. If we're lucky enough to live to menopause, it will affect every single woman, and yet it remains a hugely silent issue in the workplace. Um, we had a patient come in last week, and she's a 53-year-old female. She's a nurse. She is a seasoned nurse, amazing in her skill set. She has seen sick people. She has seen well people. She has helped people. She has saved people's lives. She's an amazing woman with so much experience. She came in so incredibly frustrated. She literally cries every day. She thinks about quitting her job. Uh, and one thing is, she had this huge level of disappointment in herself because she feels like she should understand menopause with all of her medical experience. But in reality, she was feeling incredibly uneducated. She knew hot flashes were part of menopause, but she had so much more suffering that she couldn't understand. She had the sleepless nights. Her joints ached everywhere. She had a case of frozen shoulder 2 years prior, and everybody, was like, well, you must have injured it somehow. After she ate, she would have heart palpitations. She had an extensive heart workup. She couldn't figure out why she was having heart palpitations and heart racing. And all of this really was dramatically affecting her life. She didn't feel safe almost being at work because she would have little gaps where she didn't remember words. And she was so used to being so competent that even that made her question her judgment and how she felt. She was getting urinary tract infections. And when she would go in to find out, like, why am I getting urinary tract infections, they were telling her, making sure she's wiping properly. She was just feeling like literally like she was dying. She had weight gain she was so depressed about. She she is the typical woman that we will see coming in who feels like they are at their last straw. Now, not every woman goes through symptoms like this, and not every woman feels like they're going to end up there, but you will know women exactly like this who just do not understand what's happening to their systems. And it's all related to your hormones, right? So, perimenopause and menopause, what is it? It's all about your hormones. So, that's where we get into all of the medical turbulence right now. I'm going to give you a little tidbit about the hormones. Estrogen, progesterone, and testosterone. Those are the three sex hormones that are typically most affected in the season of life. The technical term for menopause is when you have not had a period for 12 months. Now, you can have surgical menopause where they take out your ovaries or uterus, and that's an immediate menopause. But the 12 months without a period is technically menopause. But there's a 10 to 15-year window around that point in time where your hormones go wild. It's kind of like the Wild West of hormones. Estrogen surges, and then you don't have any estrogen for a while, and then progesterone is continuing to drop. Those changes wreak havoc in your system, and that's what causes all of the symptoms that people feel. Now, why do we think there's so many challenges in the workplace? It seems like, all right, well, if women make up 50% or more of the workforce, then why is this such a big issue? And we talked a little bit about this earlier, like why we know it's something that happens. So why is there a problem? Well, let me explain a little bit of a scenario that firmly sets kind of in concrete in my mind why we have such an issue. I was a resident and I was on my OB-GYN rotation. So we're seeing lots of babies and we're seeing lots of female surgeries. And we're walking down the hallway and I'm with this kind of stoic older gentleman. He actually wears his cowboy boots every day to work and he's got a little southern drawl to him. And I remember very, very specifically him talking about actually warning me about a very typical subset of women. So when I get out in practice, I need to be very cautious of a certain type of woman who will come to my practice. And those women, they complain about everything. They're tired, their periods are off, they don't want to have sex anymore, they can't think right, and they're gaining weight. It's like those women are the WWs of your practice. So he goes, those are the whiny women. You just need to watch out for the whiny women. So this was a gynecologist who sees women all day long basically minimizing and blowing off every symptom that a female might have going through menopause. So we wonder why there's questions in the workplace when, goodness sakes, in the medical profession, where we should know this in and out, and we should be able to validate and justify and explain and accept women for the phase that they're in. So it is no wonder to me that we have these issues. So we're gonna go through a little bit of these challenges in the workplace, where it's coming from, what we look at. There's no surprise to me that society is failing to recognize women in the season, but we're going to change that. More than 6,000 women go into menopause every single day, and 55% of women in the workforce are menopausal. It's definitely something that we have to look at, right? We need to focus on what's happening here. So 3 big things that we want to look at for challenges in the workplace. Ageism. I think we're all familiar with ageism, right? You're too young to understand. You're too young or too inexperienced to get this promotion. Or we have the other end of the spectrum. You're past your prime, so we have to be careful. Ageism is a huge issue. It's a big stigma. Harvard Business Review actually did an amazing study. And unfortunately, the results were not really amazing that we want to hear. But so in their study, they found that women who were approaching, corporations declined to hire women in their 50s because they have menopause-related issues that can be challenging to manage. They also found that search committees were directed not to hire women in their mid to late 40s because they'll have too much family responsibility and impending menopause. So we know these things are out there. So ageism obviously is a big deal, and we have ground that we still need to cover in that. Second big issue we need to just throw out there is the social stigma. You know, women who are menopausal really have a true fear of being judged and misunderstood. And so many women are just even embarrassed to experience a hot flash at work because they feel like they're going to be, you know, outed for menopause might harming their career. And you have to think, like, is that even warranted? Like, do we really need to be concerned about being judged if we're in menopause? And unfortunately, the answer is yes. So an interesting study that they had done is they took a woman who was actively imitating, she was having a hot flash, and they took a woman who was not doing anything. This is like at a boardroom table. One woman was having a hot flash. One woman was sitting there engaged in the meeting, and there was a man sitting at the meeting. And they had observers who were given the exact same scenario about each one's leadership skills. And they were asked to gauge what they felt about that person's leadership ability, and ability to integrate information and complete a project. The lady who was actively having a hot flash was deemed as the least able to accomplish those tasks, even when the identical scenario was given to all 3. The woman who was not having any issues was judged to be slightly less capable than the man in the room. So we do have to worry about the stigma of menopause and what's happening, but that can all be changed. In every single study that was looked at, 100% of women hesitated to share their experiences with menopause because they were afraid of discrimination. And that's huge. That's really, you know, that's where we need to kind of dig in and change how the world is seeing this natural season of what we have. The last thing I want to talk about of workplace challenges are the actual physical and cognitive changes that women experience in menopause. These are the things that need to be out there. It's not just hot flashes and night sweats. Like, menopause is not that. And the more women understand what happens to your body, or like symptoms that could be happening, the more you're going to be empowered to figure out what's going on, get help for that if that's required, or to be able to just find some accommodations that make things a little better. So hormone flux is at the heart of everything in menopause. First of all, we have period changes in perimenopause. They can get heavier, they can get more frequent, they can get erratic. You cannot have a period for 3 months, then you can have a period for 3 months, and then it's, you know, heavy and clotting and all kinds of chaos that can happen. Of course, we have hot flashes and night sweats. We have something that I like to call brain glitches. Has anybody ever experienced any type of brain glitches in menopause and perimenopause? Yeah. Oh yeah, they're no joke. So mood swings and irritability, that of course is one thing. Brain fog, right? People feel like they're trying to think through stew, right? It just, whew, why isn't my brain working? Another important one to keep in mind is vertigo. So I was recently on Facebook last night. I saw a friend saying, "Hey, can you please pray for my sister? She had these horrible episodes with vertigo." And the first thing in my head, I'm like, I bet she's about 47 years old. So vertigo is a big one that oftentimes gets overlooked. 3 a.m. wake ups, anxiety, weird smells. You don't have a brain tumor. It's usually your hormones. We've even had women who had new onset of seizures. Now those seizures resolved. But estrogen is hugely protective for the brain. And when that shield of protection gets dropped, and perimenopause is those levels just crash and then surge again, your brain is lacking that protection that it's had for all that time. So estrogen is hugely protective for the brain. And when we think about those brain glitches and all those neurologic issues, it makes sense why that's happening. We have the genital urinary syndrome of menopause. And we give that a nice big name. But basically, everything in your vaginal area dries up. So we lose vaginal moisture, we lose elasticity of your vaginal tissue, and all of that same thing happens to your urethra, where you urinate from. And urinary tract infections become a big issue. Painful intercourse becomes an issue. You can have bladder problems, bladder irritability, stress incontinence, urge incontinence. The genital urinary syndrome of menopause is an actual term. We just had a study recently come out. Vaginal estrogen can really take care of all of this. And vaginal estrogen can be used even in patients who have active breast cancer because it does not go systemic. If we were able to use vaginal estrogen in women who have urinary tract infections, that would save over 75,000 women a year who die from UTIs. And it would alleviate $2 billion that are spent in healthcare from just helping women not get urinary tract infections. So GSM is a real deal. Estrogen actually activates your specific enzymes for mood hormones, dopamine, serotonin. How many of you like serotonin? It's your feel-good hormone, right? Well, estrogen, when it goes away, that enzyme doesn't get activated. So we have a 50% drop in your levels of serotonin. We have something called the musculoskeletal syndrome of menopause. So I'm giving you all these nice big names for things that people hurt. Joints, aches, pains, tendons, ligaments. Specifically, we have gluteal tendinopathy. Has anybody heard of gluteal tendinopathy? All right, Molly, great. So gluteal tendinopathy is often diagnosed as hip arthritis, and it's where people start having this pelvic pain that can't really be explained. A lot of times it gets summed up as just joint arthritis. A lot of times people say, oh, it's sciatica, but it's actually the tendons and ligaments in your hip area that start to get tight and they contract and cause a lot of pain. This can start in the mid 40s where women are like, why can't I sleep on my right side anymore? My hip is really bothering me. They'll do all kinds of stretching and the stretching is not working. So musculoskeletal syndrome of menopause has a huge relationship to that type of pain. And the other thing is frozen shoulder. Does anybody know someone who had frozen shoulder out of the blue in their 40s, 50s, 60s? Allison. Yeah. So frozen shoulder is that other oddball thing that like out of the blue women will get this. It's a huge issue. It can take 6 months or more to try to remedy this, and catching it early is the issue. Now, if women don't know that that shoulder pain that's happening out of the blue is something to pay attention to early, it will progress. And if it progresses to the point of frozen shoulder, that's where sometimes you even have to go to surgery to release that shoulder. So catching things early and knowing it's an issue. Up to 50% of women have joint pain in menopause. And they're thinking menopause is just hot flashes and night sweats. 20% of women in menopause, the pain from their joints is the top symptom they have. This is all from hormonal fluctuation. So there are ways that we can deal with this in a really healthy way. We'll get through a couple more. Skin itchy, itchy ears. Anybody know somebody with itchy ears in menopause? Michelle. Yeah, right. Itchy ears, itchy scalp. But the ears are something that, man, if you haven't had itchy ears, that's something else. Burning tongue, skin crawling, all of those can be symptoms. Heart racing is a big one. Palpitations, people after they eat, like, why is my heart just racing? I don't know what's happening. And they get a cardiac workup and stress test and heart cath, and it's hormonal fluctuation. 50% 54% of menopausal women will have heart palpitations. 16% of those are end up at their primary care doctor with a cardiac evaluation. So it's just really important to acknowledge some of the silent struggles that women are facing in menopause, because a lot of these are symptoms that are not well known. The season can present just really significant challenges, and it's important for us to kind of rewrite the narrative. We can embrace the changes and we can thrive in the season if we know what we're working with. Half the time, it's not even knowing what we're working with. So you feel like you're chasing all of these symptoms. You think your body is falling apart when really it kind of funnels down to one area of your body that's having an issue that can work on. So what I want to do now is I want to shift our focus away from those three main things of ageism, social stigma, and the changes our body is actually happening. Let's kind of shift a focus to the obstacles, and we're going to go to the strategies and tools that can help us navigate menopause with strength and confidence and vitality in our own personal lives, but also in the workplace, which is so important. So the first thing, let's see. Oh, we already covered these. There's brain fog. I love that picture for brain fog. I just think it's so much fun. Okay, there we go. I have very few slides, probably because I just don't remember to advance them when I just get carried away talking. So, all right, so empowering us. What do we need to do? What do we do with these changes? The first thing I'm going to encourage you to do is seek some expert guidance. It is so important to collaborate with a healthcare provider who specializes in menopausal therapy. So it's the Wild West of hormone therapy out of the past 3 to 5 years has been crazy. We'll have practitioners who take a weekend course so they can do hormones. And they honestly just aren't really educated enough to be doing what they're doing. This week specifically, we had a patient come in and she was in the middle of her hormone therapy treatment plan. She was with a newer clinician, and this newer clinician was all excited because she gets to do hormones now. And in the middle of this patient's care, when she went for a follow-up, she was told, I can't continue to see you anymore because I don't have the right type of malpractice coverage, which is the most insane thing I think I've ever heard. There's no specific malpractice coverage for hormone therapy. You're taking care of a person. So that was an interesting one. We had another patient who came in feeling awful. She actually was on hormone therapy, but was on massive doses of incorrect hormone supplementation, so replacement. She was getting an online treatment. She had never actually spoken to a physician or a provider. She had filled out a survey and they were sending her prescriptions every 3 months. Now, I'm not saying that just going to somebody who seems like they've been in practice for a long time is also the right answer, because only 6.8% of physicians feel adequately prepared to discuss hormone therapy. 6.8%. So you think about all the providers out there, you think of all the physicians who are seasoned, who've been in practice for a long time. I think back to that gynecology attending that I had, well seasoned in what he knew. Only 6.8% feel adequately prepared to discuss it. So the problem with finding an expert guide to walk you through this journey, half the battle sometimes is finding that expert to work with, but it is very important that you do so. There's a lot of misinformation out there. I could spend a ton of time working on this. In 2002, there was a Women's Health Initiative. It was the study wasn't horrible, but the outcomes from that study were horrible. So much misinformation that has since been reversed, and which is fantastic, but it's very hard to change what somebody's thoughts are. When the Women's Health Initiative had come out, we had 90 million women on hormone replacement therapy. And that study said hormone replacement therapy causes breast cancer. And within 3 months, 90 million women were pulled off their hormones, down to only 4 million women. There's an entire generation who really has been disadvantaged by that study and that information. I'm going to cover only 2 key components of that study. Again, I could spend a ton of time on this. The 2 key components that they got very, very wrong, and we know this study after study since then, They said hormone replacement therapy provided no meaningful effect on your quality of life, when in fact, hormone replacement therapy is the most effective thing we can do to improve quality of life in patients who are indicated. So saying the worst thing you can do to actually, it is the most effective. The second big thing is that study said that hormone replacement therapy caused heart attacks, strokes, and cognitive decline. When in fact, all of those are found to not be true, to actually be decreased in women who are on hormone therapy. And we have found that hormone therapy actually decreases all-cause mortality. It's just a huge problem. My aunt had this beautiful bird. She kept it in a cage. I don't particularly like birds, but when I was at her house, it was nice. He saw this beautiful bird in the cage. And my cousin, when he was 6, she would let it out. So you would open the door and let the bird fly through the house. When my cousin was 6, he opened up the door, but then he's 6 and he was playing with his little friend from the neighbor, and they were going in and out the front door, and they left the front door open. So this beautiful bird that was flying around the house flew out the front door. Outside is that bird's perfect environment. Trees, wind, bugs, everything that a bird could ever want. It could fly as far as it wanted. It could fly as high as it wanted. That was the environment for it to thrive in. But that crazy bird flew back in the front door and flew into its cage. We find that same type of behavior is very typical of physicians. It's very typical of people. When you have a certain mindset, many people will choose that comfort of captivity instead of what is ideal for what is known. So there's a lot of behaviors and a lot of thoughts we have to change about hormone therapy, but we need to not be like the bird and go back to where we know things are not right. So again, I could spend a lot of time on this topic about misinformation, but just know the foundation for a lot of people's thoughts is incorrect. So the second one is, what about if we just embrace this change as an opportunity, right? So viewing menopause as this gateway to personal growth and transformation. It's an amazing time of your life to redefine who you are, to reflect on your accomplishments and embrace the wisdom that you've come across since this time. The choices you make in perimenopause and menopause will have a dramatic effect on your future. And that is one key point. How many of you would like to hike? Any hikers out there? Yeah, okay. So in the Shenandoah Mountains in Maryland, there's one particular mountain you climb to the top of. And when you get to the top of this mountain, the views are incredible. But when it rains, if it rains on the one side of the mountain, the water ends up in the Atlantic Ocean. And if it rains and it falls to the west side, it ends up in the Gulf of Mexico, Gulf of America, whatever you want to call it. So those things happen just from which side of the mountain the water falls on. And that's how I want you to imagine the decisions and choices that you make during this time, about how you see yourself and how you envision yourself, how you set yourself up to either thrive or not in this season. The choices you make will have a dramatic impact on where you end up. I have an amazing friend. Her name is Sharon. She was diagnosed with bilateral breast cancer when she was 43. She has had the most complicated history with breast cancer from a complication perspective. She's had 10 surgeries since that initial surgery. She had scarring down to the ribs. She had abscess formation after a dental procedure. She's had reconstruction that got infected and hospitalized for weeks and more surgery, like the most complicated scenario you can ever see. She's on aromatase inhibitor. She's not a candidate for hormone replacement therapy, but she's in the season of menopause. So we were discussing, what the lack of estrogen was like for her. And I really expected her to just tell me that it was pretty miserable, all the things that she was feeling and experiencing. But this is what she said. I actually want to read it because it's pretty powerful. Sharon said, because I asked her what the loss of estrogen has done for her, to her. She said, I will tell you what it can do for you. You can put up more boundaries and prioritize your own health, including mental health, more than you have ever done in your whole life. Your loss of your hormones will allow you to prioritize you for maybe the first time in your life. It's made me a better mother, a better person, a better physician, and a better leader overall. And I think that's absolutely fantastic. A lot of women think in menopause, if they can't get hormone therapy, that there's no luck for, there's no choice for them to have a better outcome or a better life or higher quality of life. And here's somebody who absolutely is not a candidate for hormone replacement therapy and is living her absolute best life ever. And the things that she has learned to do for herself and for those around her in her relationships has created the most ideal time of her life for her. And I think that's so important to keep in mind. It's kind of like Maya Angelou. She had that quote about, you may not be able to control the events that happen to you, but you can choose to not be reduced by them. And that's so important to reframe our narrative. So how can we normalize and reframe what's happening around this? How many of you have had a hot flash at work? Yeah, had a hot flash at work. And what is that like?
It totally pulls your focus off of whatever else you're doing and stops your workflow and makes your husband a little nuts. Since I work with my husband, I should probably qualify that.
Okay, great. Anybody else have thoughts on that? Allison? Oh, you're muted still. Can you let me?
Those that are on the call know that I'm the coldest human and I don't have hot flashes, but I have lots of friends who have experienced them. And my dad was a 60-year OBGYN who always believed women from day one of his practice and was the antithesis of the person that warned you about women. And he talked always about women not being taken seriously. And hot flashes they're disruptive on so many different levels, just like the brain fog, which I do experience, because you are completely consumed by this unexpectedness of that flush of temperature change and just wanting to get rid of that awful feeling. People describe it like, feeling suffocated by their clothing, right? Or constricted by their clothing because it comes out of nowhere. And then their hair's wet and, in the middle of a meeting and it's like being sick and, you get the chills and same kind of thing. Very disruptive.
So these are definitely scenarios we hear about and we talk about with our women who come in. I'm going to tell you about an interesting study. So when we talk about what can we do about this in the workplace, both as maybe employers or employees or colleagues, what can we do about it? They did an incredible study. And in the study, they took a woman who was having a hot flash at the time. And she was asked, hey, are you okay? She's like, yeah, I'm fine. But she was clearly not fine. She did not feel well during that hot flash. Yeah, I'm fine. That person was deemed to be, again, lacking leadership skills, not as effective as somebody who was not having a hot flash. They took the same scenario and a woman having a hot flash, and they asked her, are you okay? She's like, I'm fine. I'm just having a hot flash. I'm in menopause. That person actually was deemed to have higher and stronger leadership skills than somebody who was not having a hot flash. The sole fact that they were owning it and they were simply disclosing their menopausal status and just carrying on, doing what they needed to do to get through the hot flash and then carrying on, was perceived to be a very strong and high quality. Now, that's completely opposite to what we typically see in the workplace, where women just kind of suffer through it silently and they try to go unnoticed and try to make sure nothing is, being disclosed about where they are in menopause. So the simple act of disclosing. So what we're not used to is women actually talking about it and just moving through it. It's really, really important, especially as we think about generations coming up, that we can normalize what menopause is, that we are still incredible, powerful women, even if we have hot flashes. It's a time where we have to make accommodations, and it's a time where we have to maybe tweak what we're doing and focusing on stress and boundaries. But it's an incredible time. When you think about normalizing what this looks like, one, we're going to be held to a higher level of our wisdom and where we are in our success if we own up to where we are in our lives. But you think, can that actually happen? And you have to wonder, is that ever going to be possible? Are we ever not going to be looked down upon or just not getting the same advantages? But think about breast cancer. So 10 to 15 years ago, breast cancer, I'll say 20 years ago, it was a taboo topic. People didn't talk about it. If you had breast cancer, it was, I have cancer, but you didn't want to talk about the fact I have breast cancer. And now think about breast cancer. You wear the pink. We all wear the pink. We do the walks. We do the fundraisers. I have breast cancer. I need support. We can completely normalize what this season looks like, and we will be better for it. And the women who come after us will also be better for it. So what I would encourage all of you to do is normalize the symptoms we experience. Michelle Obama had she had a really great kind of like way to look at things. And she's like, there are 3 friends you always need in your life. You need one friend in front of you to look up to. You need one friend beside you on the journey, and you need one friend behind you that you can bring along. And as women really supporting each other, if we had that 3-friend model, we could do so much. One in front of us we look up to, one beside us on the journey, and one that we could bring along to make things better for them. So I would encourage you all to think about who those 3 friends are. Think about who those 3 people are in your life, and focus on how we can support each other better so that we can normalize what our bodies are going through as we get through this journey. Building those support networks of your family and getting leadership buy-in. If you are the leader at your company, if this is your company, if you are in the executive positions of your company, leadership buy-in is crucial. So there's different workplace organizations. We have the employee resource groups we can do, just really striving to create a psychologically safe space. If you know women are having hot flashes, have fans accessible. It doesn't have to be a big deal. If you see somebody walking around and they're visibly having a hot flash, hey, do you want a fan? Anything I can do for you? It can be completely normalized to help people. If you have temperature controls or thermostats that can be placed in rooms, that's great. If people need some time built in their schedule so that there's more flexibility, if you're having a hot flash and you need to take that 15-minute break, that you support them to do that. You do not want to lose one of the greatest assets in your company, which is women with so much wisdom. And we are going to lose them if we don't support them in this season. 1 in 5 women has considered leaving their jobs in menopause because they don't feel understood or they don't feel like they can do their job the same. So it's incredibly important that you create an environment that's supportive for women, and you build those support networks about how best we can help them thrive and continue to thrive, because they are an incredible asset to our businesses. So a menopausal woman is a powerhouse. She's a powerhouse of resilience and experience and wisdom. She is invaluable to your company and as a friend and in your support system. And it's really important that we keep that in perspective. We are not weaker. We are not sicker. We are not invalids in our menopausal state, we are women who are powerhouses of experience and resilience, and it's so important that we keep that in mind. So key takeaways. Menopause is a natural stage. It has challenges, but it also has a lot of opportunities, and it's important to focus on what those opportunities are. A supportive and informed approach is going to really help us maintain our productivity and well-being in our personal lives and in our professional lives. As far as what I would recommend that you do, I would encourage you to seek an expert guide with you on this journey. If you are age 35, you are experiencing perimenopausal hormonal symptoms. I will tell you that now. So not the 20-year-olds, most likely, but those 30-year-olds, yeah, welcome to the world of perimenopause and menopause. So find an expert guide to help you on this journey. Start conversations to break the stigma. Be open about what you're experiencing so it can normalize it. That's the only way we're going to normalize what's happening. Normalize perimenopause and menopause. And then implement strategies that really help with health optimization, deep breathing and walking outside and setting boundaries, doing good self-care so that your body has the ability to deal with these changes in a more fluid way. Embracing this phase of life with courage and confidence is really what it's all about. So just in closing, menopause should not be the end of anybody's vitality or career. It's a transformation in your life. It's this new chapter, and it's filled with opportunities for growth and empowerment and thriving if you choose for it to be that way. So what kind of questions do you all have?
Melissa, are there any resources that you recommend, any books or any go-tos that you feel confident in and like to recommend?
There is one book that I think is fantastic, and it's this one. It's a fairly easy read. It goes through kind of current research and puts it in a really nice context. It's The New Menopause, and it's by Mary Claire Haver. She is an OB-GYN who is really out there being a strong advocate for women in the menopausal and perimenopausal season. She has great social, constantly putting out new information, constantly putting out new study summaries out there. So she's a wonderful resource for somebody who's just trying to navigate. What does this look like? You have to be really empowered when you go talk to a physician. If you're talking to a physician who does not feel comfortable with menopause and they say it's just a natural season of life, it's something your body just has to go through. There's nothing I can do for you. Being an advocate for yourself is now more important than ever. And this book does a really nice job of walking through some of those scenarios. What's false, what's true. Not everybody's a hormone candidate. There's a lot you can do in addition to that instead. So that's probably my favorite resource as a general book to recommend.
Thank you.
Sure. Any other questions?
I don't have a question. I just wanted to say thank you. I'm kind of on the other side of menopause since I'm 60, but now I know I'm not crazy. Like the things that I was going through, especially that brain fog. And I did go to my doctor when I was having like sleeplessness and just fatigue for no reason. And she's like, but everything looks fine. And I thought, okay, so I am crazy. So knowing that, the heart palpitations, that was a real thing that really concerned me. So knowing that I wasn't crazy, and now, for those younger than me, if they have a hot flash, I can say it's so much more than that. Are you having boom, 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 boom? Now I'm informed and I'm equipped to help bring them through that. And also to look, because I have some employees who are in that age range, so I can keep an eye out for them too, and just kind of help them. This whole presentation is just phenomenal. It's so valuable and vital, and I really appreciate you and celebrate your skills in this space.
Oh, thank you so much, Crystal.
Melissa, why isn't this a topic that's covered by OBGYNs? I mean, why is it does it not make enough money? What's the issue?
Well, there's that. But it all comes back to money, it seems, right? But honestly, even in medical school, So in functional medicine, a lot of what I do is self-taught. It's studies, it's going back to cellular physiology. It's really figuring out like, why do things happen? Because once you graduate from medical school and you're done with physiology and pharmacology, anatomy, once you're done with that, you get into the medical world where you're actually practicing medicine, and you'll find that you're really not learning or relearning or digging deeper into something unless it has a pharmaceutically driven treatment. So that's one issue. The second thing is, in medical school, we learn about what all the hormones do, but you don't learn what happens when the hormones stop. So there's really not even education on menopause. Like, what does menopause do? There's no education on that. It's all about, when you're a woman and you're having periods, we know what to do with that. And then there's the fertility phase, if women choose to have a baby, or if they're able to have a baby, or they choose not to. There's that phase. And pretty much after pregnancy, nothing is really being addressed in women's health until they're menopausal. And then, okay, once you're menopausal, it's okay, now you're menopausal. There's a huge portion of women's lives that just get completely disregarded after fertility. So mostly we don't learn about it in medical school. And secondly, you had this Women's Health Initiative study that had 20,000 women in it telling us that hormones cause breast cancer. And that was hugely detrimental. And it's working against that now and changing mindset based on studies and research. But then that's a huge ship to shift, to turn directions on in a world where people aren't usually comfortable even talking about it.
Challenges, for sure. We've got a couple questions in the chat, so I just wanted to share those. So one is, how do I go, how should you start the process of finding a doctor if the one you currently have doesn't specialize in hormones?
That's a great question. Hopefully there's somebody that who's having a good experience with hormone therapy, or just perimenopausal and menopausal therapy. I say hormone therapy, but to me, it's like encompassing everything. Are you a candidate? Are you not? How can we help you benefit? So hopefully there's a growing network of women who are having very valuable experiences with a provider. That is one of the best ways. There is the Menopause Society. Now that's just that's a self-submitted organization. It's not like there's significant criteria, but at least it's people who are very familiar with hormone therapy, who's a candidate, who's not, perimenopause and menopause, and how to help women thrive in that season. Just like anytime you're trying to find somebody new to develop a relationship with, sometimes they're going to be good, sometimes they're not. So at least it'll help funnel it down. So menopauseSociety.org, you can often find names of people, at least in your area, but I would work through your friend network first.
Awesome, thank you. The other question is, thank you for this discussion. And do you recommend blood work? And I hear this too. Like, I hear, depending on whose OBGYN has what, oh, so-and-so is doing this and they're looking at markers and my numbers are this, and oh, mine doesn't do it. What are your thoughts on?
That is a great question. And I would say, like, I think about my kids, and just when I thought I had them figured out, they went to a new stage and all of it was new again. Like, oh, shoot, we just had. So your body's like that too, women's bodies. So every season of your life is very different in what we look for in testing. So, when women are young and they're having cycles, if it's a normal type cycle, you really don't need to check them because things are functioning properly to even have a cycle. When you get into perimenopause, that 35 age and up, typically, there are things that we can look at. However, in perimenopause, you want to be looking at everything that supports the hormone system. So you need to be looking at gut health and thyroid and nutrient levels, stress levels and sleep and nutrition and activity. All of those are going to support the wild nature of what those hormones do. In perimenopause, the testing you do is if we're looking for pathology, because in all honesty, I could check somebody's estrogen level on one day in perimenopause and it can be ridiculously high. And then a week later, it can be dried up. So perimenopause is this, and it's more of history that's important. It's not a 7-minute office visit. It's the half-hour office visit to find out. And then in menopause, or as you get close to menopause, we do start to see the effects that those hormonal changes are having on the rest of your body. And testing does become a lot more important at that point to see where your body is. Estrogen, you can usually check in blood work. Testosterone, you can check in blood work. Progesterone is not great to check in blood work because your body breaks it down so quickly. So there's other forms of testing that are required for those things. So you don't just want to say like, hey, can I have a hormone panel unless you know exactly what you're looking for and in what season.
That
Thank you.
helps.
Mm-hmm.
Good questions.
Mm-hmm.
I have another question. I was the one who typed those in. And I don't want to take up time from anyone else, but the other question would be, I'm in that stage of where all of a sudden, diet-wise, what used to work, I'm noticing the weight gain, and it's like, okay, what's happening? What used to work and I could just get it off in no time is not working anymore. So what thoughts do you have regarding that? And then the other part of my question is, I have an upcoming, just regular well woman visit coming up, but I am 44 and I'm just wondering what other things should I, of course, if there's anything in particular that I am experiencing, I should mention, but at this upcoming visit, what are some of the questions that we all should be asking at our regular well woman visit? And as we're trying to find this journey of new doctors too. So 2 parts.
I love that. That is so great. We actually have a list that I made of questions you should ask your provider when you go to a
Okay.
visit. So, maybe I can find a way to get that shareable, and then you can kind of look through it and see.
Amazing.
In this book, there's also some references to good questions too. So that's just as like a resource for you in the background. But at 44 years old, we know that your hormones are doing some pretty crazy things right now. They're surging, they're dropping, they're surging, they're dropping. That's with estrogen. Progesterone starts dropping in your mid-20s. Now, progesterone is your balancing hormone to estrogen. There's like estrogen and progesterone are on a teeter-totter, and it's better when they balance. Now, in perimenopause, your estrogen's doing this, and your progesterone, unfortunately, just keeps dropping. So you can visually understand like why your body is starting to feel certain things. Now, progesterone is your sense of well-being hormone. It's calming. It helps you sleep at night. And when you think that by the time you're in your 40s, that's almost not being made anymore, you can understand like where sometimes the irritability and the mood fluctuations come in, because all of a sudden estrogen is doing the craziest jumping around and you've got nothing to balance that out. So making sure that they're comfortable discussing things like if your sleep is disrupted, if you're starting to have vaginal dryness type issues, or if libido is dropping off and you don't feel like sexual wellness is, your sexual health is where it needs to be. Those are all very, very important things to talk about. If you're having breast tenderness, if you're having mood swings, please, please, please do not go to an antidepressant for that, or just get put on birth control for that. Really find out ways that you can ask questions about how can I more naturally navigate this process while my hormones are doing wild and crazy things. Gut health is hugely important. So from a nutritional perspective, just knowing that you need to eat 6 to 9 servings of vegetables every day. Now that's not 6 to 9 cups, but servings. Most of the time a serving is a half a cup, unless it's like a leafy green. So make sure you're eating so many vegetables, because that nourishes your gut. Your gut is responsible for getting rid of all that extra estrogen. And if you don't, estrogen goes back through for another round of making your system crazy. Gut health is hugely important. If you're having issues with your gut, bloating, gassiness, changes in your bowel habits, talk to your provider about that, because that needs addressed. If your gut health is not good, you're not going to navigate this season as well as you could. So sleep, nutrition, gut health, ways to kind of help navigate some of the hormonal fluctuation you're experiencing. Those are some key areas that I would make sure you're talking to with your provider.
Thank you.
Mm-hmm. Those are good questions. Any other questions popping up anywhere?
Chat looks good. You've answered those.
All right, perfect. Well, it has been my pleasure to be with you on this Friday morning. at whatever time you're joining. So thank you again for the opportunity. I really appreciate it.
Thank you.
Mhm.
Thank you so much. This has been an enlightening presentation, and I love the conversation. I think we need to have more of it everywhere we go. And I also appreciate you tying in the sleep, the gut health, all of that, because I think it gets put in a box and not looked at fully. I mean, even in conversations I've had, yeah, that's never come up, and it makes total sense. It just hasn't been addressed. So I really appreciate it. I'm sure we'll think of more questions, and if I think Erin might be able to send out the questionnaire list for the doctors, possibly if you provide that to Erin, Erin can get that out. But thank you all for joining us this Friday. I hope you all have a wonderful weekend, and we will see you next month at